Good morning. I will discuss anorectal function, dysfunction and surgery. Fecal incontinence and obstructive defecation here co-occur frequently, but they also co-occur with chronic pelvic pain and bladder symptoms such as nocturia, frequency, urgency and abnormal emptying, because they all have the same etiology. Lax uterosacral ligaments. We'll go into this in a minute, which can also cause uterine prolapse. This is a 3D view of the pelvis from above. Bladder, uterus, the rectum coming here and in between the uterosacral ligaments. There are 4 directional muscles: puborectalis, which attaches directly to the symphysis, puborectalis, forward-acting, levator plate, backward-acting, LMA, downward-acting. For continence, the puborectalis muscle contracts forward against the posterior wall of the rectum. Levator plate is attached to the posterior wall of rectum, contracts backwards, and the conjoint longitudinal muscle of the anus, LMA, pulls down against the uterosacral ligament to rotate the rectum around the contracted puborectalis muscle to close the anorectal angle. The difference between defecation and continence is one muscle, the puborectalis muscle. When PRM relaxes, then the rectum stretches back down to here. These 2 muscles, LP and LMA, contract against the uterosacral and they pull back the rectal wall, opening it out to where the broken lines are in preparation for contraction of the rectum for evacuation. Opening it up vastly decreases the resistance to expulsion of the feces. You will note that the uterosacral ligaments were the insertion point for both continence and defecation. Therefore, laxity in the uterosacral ligaments explains why fecal incontinence and obstructive defecation often co-occur. So there are 2 vaginal repairs where polypropylene slings are inserted for cure of obstructive defecation and fecal incontinence. The posterior IVS, the entry is perineally alongside the rectum and the tunnel goes in. The sling is attached to the posterior wall of the cervix or vagina, exits through the perineum, and that irritates the tissues to form an artificial uterosacral ligament. For the TFS mini sling, the vagina is opened directly and the sling is attached. It's an adjustable sling to the uterosacral ligaments. It's tightened and that reinforces and tightens the uterosacral ligaments. Gershon reported 80% cure of obstructive defecation through the posterior IVS, entry via the perineum, and cure in these other symptoms as well: pain, frequency, emptying difficulties, urge incontinence, residual urine. Here, Lidl, 611 cases, reported 65% cure for fecal incontinence by direct application of a mini sling to the uterosacral ligaments. He also reported cure of chronic pelvic pain. You can see here 77, frequency, urgency and nocturia. Thank you very much.